Hello guys, welcome to our channel. Today we'll be discussing the radiology rapid revision. This is the last subject of all the rapid revision sessions and I'm giving the 10 days time. Almost we are about the 8 days time guys. So in this 8 days, as much as you can, you finish all these rapid revision sessions which is only just 1 to 2 hours. Spend those 2 hours and complete all the important topics and the MCQ practice, and this is going to help you a lot. At least 80 plus concepts and the topics from these rapid revisions can be reflected in the questions of the final examination. So don't give the chance to miss this. Please take time 1 to 2 hours of a day and spend them and read those topics. And if you are appearing for the upcoming examination, also I recommend you to watch the Sureshot series of the next 3 parts, also 150 topics that we are going to discuss, and in that also we are expecting at least 50 topics or the 50 concepts to be reflected in the final examination. So don't forget to subscribe and share with your friends, and do like this video so that it will reach the more students. And unfortunately the Telegram is banned in the India, so for this up session PDF will be uploaded in the below Google Drive link. From there you can access. Okay, so let's start the session guys. So we will be discussing the radiology rapid revision topic. So let's start the discussion. So he is the Dr. Roe Antigen. Okay, Roe Antigen. He is the first person to develop the radiology, and this is belongs to his wife, and this is her, this is their engagement ring. So he is the first person to discover the X-ray, and he has understood underlying pathologies is not always to be dissected or has to be taken the biopsy. We can also get it from the radiographic images. So from that idea he has discovered this X-rays. X-rays, this is the first X-ray that has been taken in the 1870s. Okay, that is the important point. So whenever the radiology is highly concerned with both the risk and the benefits. So if you look at the benefits, we are actually looking the underlying pathology. But if you think about the what can be the determinant, or what are the very disastrous outcomes also from the radiology. To have the concerns from the radiology, it can cause the cancers, it can stop the our cells division, it can damage our system also. Right? So that's why we have thought that we should use this wisely. We should not be using this only for the not only for the diseases, we should also concern about the radiation exposure, and we have to limit those exposure. That is the one point. So for that we have arranged for the most of the places. If you observe, we are going to see these kind of symbols, right? So what are these symbols indicated? For example, this is symbol is used for the biotechnology. Okay, for example, chemotherapeutic agents and also bioterrorism agents. For this biotechnological labs, they concerned of these symbols. And this is for the X-rays. This is for the X-rays. The X-rays most commonly which will be limited exposure, especially for the infants. Okay, sometimes infants also we do X-rays, right, if they are the serious conditions, but most of the times it is also restricted. And pregnant female, and also those who are highly having the pluripotent conditions, which will also we will be avoiding this kind of the X-rays. And next we hold the tree flock. This tree flock is important for the certain radiation exposures, for example nuclear rays and CT scans, CECTs, PET scans. All these missionaries also we are going to follow this symbol. So they are the three symbols. This is for the biotechnology, this is for the X-rays, and this is for the CT scans, PET scans, and the other important scans. Next, and despite of these warnings also, if ever the person has to enter, especially staff cannot stop with the warnings, but they have to protect for themselves also from the doctors, from the technicians, from also the those who wanted to clean that particular room. So for them we are going to use this apron. This apron is known as a lead apron. How much is the thickness? The thickness is around 0.3 0.5 mm. This thickness will be 0.5 mm, and it is going to consist of the complete, it is going to cover our most important parts of the body, for example thorax, for example abdomen, and also gonads. All this will be completely covered. And also if you can observe, they will be also having the collars. Some aprons will be consisting of the collars also, and that collars is going to helpful from the thyroid radiation exposure. Next, despite of that also, they will be carrying the mostly whoever the radiology department, they has to carry this badge. This badge is known as a TLD badge. So what is the important of the TLD badge? It is going to cover all type of the all type of radiation which will be noted in this TLD badge. For example, you can see this is made of the aluminum and the copper. It will be measuring of the X-rays and the gamma rays. And next, plastic filter, which will be important for the beta rays, X-rays and the gamma rays. And the no filter, which will be exposure to the all type of the radiation. And how many months it will take to we are going to look for. So at least it will be covering of the 3 months of the radiation exposure, and after that you have to send this to the laboratory. For example, in India we are going to send this to the Baba institution, Fmge Baba institution, and there they are going to check whether the how much radiation is exposed by the person. For example, let's say that the person is belongs to the radiology department, how much he has to expose. So at least 100 types of the radiation in the last 5 years, which should be limited for this patient. Okay, and less than 30 per year, less than 30 per year, and overall if you take, it will be less than 100 in last 5 years. That is, the exposure is limited for this radiology department. Okay, these are the important points, guys. Next, moving on to the radiology. So radiology is about the frequency. It is about the how much is the frequency and how much is the energy it is producing. For example, if you consider these two, the both has to be in the higher range. So the maximum which will be covered for the gamma rays. So gamma rays will be consisting of the maximum frequency and also maximum energy. And what is the minimum? Minimum will be for the sound waves. Minimum will be for the sound waves, and sound waves we use for the ultrasound missions, right? So this is how the frequency and the energy will be consisting of. And radiology units also we have to remember. So radiology units, if you can observe, there is a exposure dose. So there is a exposure dose. So what is this exposure dose? So the exposure dose which will be by our most important person, raw antigen only. So the first exposure dose which will be noted, and we are going to call this as a raw antigen conventional unit. And if you converted this to the SI units, it will be in the coulombs and the kgs that we are going to see. Next, what is the absorbed dose? So absorbed dose which will be consisting of the rats in a conventional units, and rats will be converted as a grays. Rats will be converted as a grays, which will be considered as a SI unit of the condition. Okay, these are the important points, just two important points that you have to take note. What are the rats conventional units and what are the S units, that is the gray units, right? Next, TLD batches that we already mentioned, and the lead apron. These are the just basics that you have to take note. Next, X-rays or the gamma rays or any radiations, if you can observe, they have the two types of the effects. One is the stochastic effect, and other one is the deterministic effect. So what is the difference between the stochastic and the deterministic? So stochastic, which will be independent of the dose. Okay, this will be independent of the dosage. And deterministic, remember that the sorry guys, so deterministic, D for dose dependent. This is the dose dependent. So stochastic, it is not even at the related to the, for example, if you take the low dosage or the high dosage, it doesn't make any differences, right? It is just dose independent. Even at the low doses also you will be having the cancer risk, and even at the high doses also you have the cancer risk, right? So this will be related to the low dose. For example, if you take the dose is independent of the stochastic, so at the low dose you will be having the higher complications. For example, mutations, genetic mutations can be seen at the low dosage, and cancers, carcinogens, that will be also seen here, right? Next, coming to the dose dependent. So high the dosage, right? High the dosage, high the effect, that will be deterministic. And example are acute radiation syndrome. This is the one of the example. And also anemia or pancytomania, bone marrow dysfunction will be seen, and skin erythema will be, skin lesions will be seen in this patient. Cataract formation, which will be due to the infrared rays, that is also seen. All this will be considered as a deterministic. And the question they asked, what about the fetus exposure? Fetus exposure comes under the stochastic or the deterministic. So for the fetus, this is a teratogen. So teratogen will be considered under the deterministic effect. Okay, these 2 points that you have to remember. And in the radiation, there is a one thing that you have to remember, that is a radio sensitive and the radio resistant. So what is the radio sensitive and the radio resistant, guys? So they are the two types, right? Radio sensitive and the radio resistant. So there is a cycle, every cell has the particular cycle, and they have the synthesis phase, there is a mitosis phase, and there is a quotient phase, which is a resting phase. All these phases which will be helpful for the and prevent the conditions like genetic conditions, carcinogenesis, and also the cell normal physiological process, and that is going to maintain by these cells. But if there is in particular situations, for example radio sensitivity, which will be high at the GTM phase, okay, at the GTM phase, then the mitosis phase. During the mitosis phase, the cell is very sensitive, even at the low doses also we may have the disease. Next, radio resistance. Radio resistance is seen in the S phase. Radio resistance will be seen in the S phase. And what are the organs? In the radio sensitivity is highly seen with the gonads. Gonads are prone to more risk because see, seminiferous tubules, it is always sperm production. Follicles are the 15 days of the cycle is always follicle production, right? So the gonads are going to have the more risk for this. And how about the tissue? The bone marrow is going to be the more risk for these patients. And also lymphocytes, they also risk. And cataract formation, that could be lens. Next, coming to the radio resistant, example vagina. Vagina is highly resistant to this condition. And also nervous tissue which will be less highly resistant, and platelets, and also sclera. So these are the difference between the radio sensitivity and the radio resistance. We also have the cancers which will be related to the radio sensitivity, which are developed only due to the radiation. Example are seminoma, Ewing's sarcoma, Wilms tumor. These are the cancers that will be very radio sensitive and radio resistant. Despite even if you give the radiotherapy for this patient, that is not going to treat these conditions. For example, hepatocellular carcinoma, osteosarcoma, and also melanoma. These are the conditions very radiation resistance, and sometimes radiation can also cause the conditions. What are these conditions that you have to remember? For example, radiation can cause the acute radiation syndrome itself. What is this acute radiation syndrome? In the acute radiation syndrome, we can develop the effects. So in the acute radiation syndrome, so highly there is a acute effects which will be affected. For example, if you have exposed to the 1 to 2 gyrus of the radiation exposure, this can cause the hematological conditions. Okay, this can cause the hematological conditions. Hematology like bone marrow dysfunction, pancytopenia, that will be seen for these patients. Next, you have exposed 10 gyrus, 5 to 10 gyrus, let's say. It can cause the acute GI conditions, GI tract, that can be affected. More than 30 gyrus, it is going to cause the CNS effects. Why this is different from this condition? Because if you observe, guys, why it is different? As I said, nervous tissue, that is highly resistant. So more the dosage, it will be having the more the condition. Less dosage, it is not going to show this one. So that is the acute radiation syndrome. And acute radiation syndrome, what are the early causes? So early causes will be pancytopenia. So the patient can have the pancytopenia. That is the blood cells, all the type of the cells which will be decreased. And dermatitis. So radiation related dermatitis, skin erythema, or the flushing, that will be seen in this patient. And also alopecia, right? Hair loss will be seen in these patients. And most commonly, every patient who is exposed to the radiation, the symptom that they are going to have is the nausea and the vomiting. And for this patient, the drug of the choice is the ondansetron. For this patient, we are going to give the ondansetron. And along with that, they can also have the esophagitis, radiation related esophagitis will be seen, and patient can have the diarrhea. These are the GI symptoms that will be associated, and there can associated with the late symptoms also. And late symptoms you can think about cataract formation, right? Late symptoms. And also over the time, if esophagitis, it can form the ulcers, and ulcers can prone to the fistulas, that can be also seen. And they can also prone to the fibrosis, for example lung fibrosis, and they can also cause the carcinoma. Different types of the carcinomas will be seen, and one of the examples is the papillary thyroid carcinoma. Papillary thyroid carcinoma, that is associated with the cancer only, it will increase the cancer chances. And example, meningioma is also due to radiation exposure. And also seminoma is also due to radiation exposure. And another condition like AML and ALL, leukemias, acute leukemias is also related to the radiation exposure, right? These are the conditions that will be associated with the radiation exposure. Next, coming to the important points that you have to take note is how we are going to see the radiology. Okay, how we are going to see the radiology, right? Next, in the radiology, the points that you have to remember, radiation is divided as a ionizing radiation, and other one is the non-ionizing radiation. How we are going to differentiate? So ionizing radiation, for example X-rays and the gamma rays, which will be used. Alright, next, non-ionizing radiation. There is a UV light exposure from the sunlight, and also we have the infrared rays, which will be used for the disinfection or the sterilization. And in our households we use for the microwaves, and also different types of the radio waves around us from the exposure. So these are the two types, ionizing radiation and the non-ionizing radiation, which will be presented. And how we are going to differentiate from the X-rays? So everything here you can see, this is the X-ray, right? And this is the MRI, and this is the CT scan. How I have differentiated these three from the image itself? So for example, how you are going to differentiate this by difference? All the rays, all the imaging will only show us two colors. One is black color and other one is the white color. So but this white color or the black color has to be differentiated, and they have the specific terms for each one. For example, when I say MRI, in the MRI you can see the bone is not as thick as in the CT scan. That is the one differences. And the soft tissues are more clearer, how the exposure is seen. For example, here soft tissues I can't see properly, and here soft tissues are can be seen but less, and here the soft tissues are better seen. So this is the differences. And here I can see air properly from the lungs, I can see air properly, and here I can see the soft tissues and the air, and here I can only see the soft tissues, right? So this is how we are going to differentiate. And here only the bones are visible, and here bones, and also the spinal cord is visible, and here also the peripheral nerves is also visible. So the more the higher the scan, higher resolution and higher procedure that we can visualize the underlying pathology for this different types. So what are the terms that we use for the X-rays? In the X-rays, when you want to call this as a black or the white, so we have the specific terms. We can't just say this looking more white or the black. So we will be using of these terms. For example, for the X-rays, the white is known as a opaque. So higher the opaque, higher the pathology. For example, it could be normal also, bone, or black means it is a lucent. Lucent means it is air. Okay, air is going to known as a which will be known as a lucent in the X-rays. Alright, next, coming to the MRI. In the MRI, we are going to call this as a hypoperfusion and also hyper. So hyper will be for the white and hypo for the black. This is for the MRI. Next, for the CT scan, black is hypodense. For example, again air, and white is for the hyperdense. This is for the bone. Okay, like normal bone structure also we are going to see here. And ultrasound black will be known as a hypoechoic, and the white is known as a hyperechoic. So these terms that you have to take note about the X-rays and the different types of the rays. So these are the main important points, just a general information that you can remember, guys. And let's move on to the radiotherapy. In the radiotherapy, we will be discussing, before we see the what is the normal, we will just understand what is the radiotherapy also, because radiotherapy questions has been increased in the recent times. That's why it is important. So always remember, the radiotherapy that we follow is to eliminate the cancers, right? So radiation or the radiotherapy, in the higher the frequencies, that we are going to eliminate those cancers. And the most commonly used is the gamma rays, right? Most commonly we are going to, here also we use the gamma rays to remove these cancers, right? So we have the different types of the radiation. How this radiation which will be working, guys, just it is going to use the ionization. Whatever the particles or the molecules it is going to use, it is use the ionization. And most commonly it is going to kill the free radical injury. So it is going to kill by the free radical injury, or it can also damage the DNA. So DNA strands will be damaged, so that the cell will be also going to damage. That is how we are going to use. And different we have, for the X-rays we use the cobalt 60 for the X-rays we are going to use, and it is around 5.3 5.2 years it is going to have. Sorry, these are the gamma rays, these are the gamma rays. And X-rays, we have the LINAC X-rays which will be used. Gamma rays is very costly, we use the gamma rays, but in the settings of the government side or any other side, we use the X-rays. X-rays is more easy and more less costly that the patients will be getting from this. And other one, we use the protons. This is used by the Bragg peak. So Bragg peak phenomena is used by what? Bragg peak phenomena is used by the protons. Next we also have the electrons. Okay, electrons which will be used for the intraoperative. Electrons are intraoperative conditions where we are going to give this radiotherapy. Okay, and radiotherapy, how this is it is going to work? There is a law of intensity. We call this law as a inverse square law. Inverse square law. What is mean by the inverse square law? So inverse square law is going to indirectly proportional to the distance. Okay, it is going to indirectly proportional to the distance. So the more the distance, more the intensity of the radiation. Okay, so the more the distance, less the intensity. That means it have the more distance from the radiation. And high intensity, so it have the, sorry, it will be having the low distance. So how, what am I trying to tell here? For example, let's see here. So there is a patient here, and here you are producing the rays. So this is going to kill this particular radiation exposure. For example, this is the thorax, lungs, we are giving the radiation here. So less the distance, more intensity. It is going to kill only the particular thorax part only. For example, let's say the distance was this and same thorax, so it is going to have less intensity to the thorax, and apart from that there is a radiation exposure to the entire body. So this is how the law of inverse square law, which will be explaining us about this X-rays. Okay, this is the 2 points that you have to remember about the radiation. Next, apart from that, the radiation can be different type of the radiations. For example, we have the fractional type. So we have the fractional radiotherapy. So fractional radiotherapy is also known as a conventional radiotherapy. So how many sessions we give? 5 episodes we give. per week, and one day which will be given as a holiday. So in this holiday we were giving the other cells to regenerate, not all the cells has to be die. Okay, this is the most commonly used for the patients. Monday to Friday, one day will be holiday for this patient. And the other one is the hyper and also hypo. Hyper means more than 5 episodes, hypo means less than 5 episodes. This is how we are going to see. So hyper we use for the aggressive tumors, right? More the aggressive, they need the more the aggressive therapy. And hypo is used for the palliative treatments. For example, they are more old age. For example, prostate cancer, 70 plus years, we can't tell the patient to have this frequential conventional therapy because they are the more the side effects for these patients. That is how hyper and the hypo regimen that we are going to use for these patients. Okay, this is how we are going to see. And we also have the brachytherapy. So what is the brachytherapy, guys? Brachytherapy is given for the directly from the high dose we can use, and brachytherapy can be used for the low dose. And there is a intracavitary, it is also intracavitary and also extracavitary. So there are the types of the brachytherapy only specific to that organ. Okay, this is only specific to the organ. For example, cervical cancer, by the intracavitary we can produce this brachytherapy. For example, there is a extracavitary. For example, let's take pineal cancer. There we can put the cap like brachytherapy. We can produce the therapy, right? So this is how the radiotherapy, different types of the radiotherapy that we are going to use. So from now we are going to discuss the what are the general principles that we use in the types of the ultrasound. For example, ultrasound has the different types of the probes. These are the different types of the probes. We have the linear probe. Okay, this is the linear probe that we are going to use, or the curvilinear type, and this is the linear type. This is the phased, this is the curvilinear, and this is the linear type that we are going to use for the different types. Why this is different? Because how the radiation from the ultrasound which will be working. So the radiation from the, it is going to produce the sound waves. It is going to produce the sound waves. For example, the transducer, this one is going to produce the sound waves, and sound waves will send the right here. So they contains of the crystals. They contains of the crystals. What are those crystals? The crystals is known as a piezoelectric crystals. Piezoelectric crystals. These are made by the lead zirconate. Lead zirconate. So this sound waves produced by this, it is going to hit these crystals, and these crystals is going to hit the tissue. Okay, this is going to hit the tissue, and again tissue is going to hit back through the sound waves these crystals, and these crystals is going to hit back the sound waves, and we are going to get the image. So this is how the general principle of the ultrasound which will be working, right? So from the machine we are hitting these crystals, and these crystals is going to hit the tissue, and tissue will hit back, and we are going to produce the image of our patients. So that is why we have the types. This is the phased type. It is going to use the 1 to 5 microhertz, and this is going to use for the heart like echocardiography, lungs, pleura, and the abdomen. Curvilinear type, this is going to use the 5 megahertz, and this is for the gallbladder, kidney, liver, and bladders, uterus, and the ovaries that we are going to see. Linear type, this is used for the Doppler like arteries, vein, musculoskeletal, testicles, eyes, and the breast. So this is the different types that we have so that we can visualize, right? And also they are the transvaginal and transrectal also we will be using for the intracavitary types of the ultrasound images. Next, coming to the fast and the e-fast. Fast and the e-fast is also about the sonogram. What is the sonogram, guys? Sonogram is about the ultrasound only. So the basic principle is simple. It is going to produce the get from the sound waves only. And fast is used for the emergency. Fast is used for the emergency. And how, what are the locations that we are going to use? We are going to use the 4 locations only. We are going to look at the 4 locations. For example, first we are going to look at the subxiphoid for the heart, pericardium, then followed by the right upper quadrant, then lower upper quadrant, then pelvis. We are going to look. E-fast is an extended type. Again, this is for the subxiphoid, and then right upper quadrant for the hepatic, and left upper quadrant for the spleen, and then pelvis, and also thoracic, both the lungs we are going to look at here. Next, moving on to the CT scan. So how the CT scan which will be working? Again, this is going to use the gamma rays. This is going to use the gamma rays as an important part of the CT scan, and CT scan was discovered by the Hounsfield. So that is why whenever we use this Hounsfield units which will be considered for the CT scan. So CT scan has a minus 1000 Hounsfield units. Minus 1000 Hounsfield units is given for the air. So it is very hypo dense that we are going to see, black color. Next, 50 to minus 100, this is for the fat tissues Hounsfield units. 60 plus 60 to 70, this is for the blood, and plus 30 is for the contrast. This is given with the contrast. Next, 200 to 250, this is for the calcification. This is for the calcification tissues, and plus 1000, this is for the bones. This is given for the bones. And Hounsfield units 0, that is for the water. So for the fluids, it is 0 Hounsfield units we are going to see. Next, coming to the indications of the NCCT, non-contrast CT scan. So whoever is suffering from the anaphylaxis to the contrast, so patient is having the risk of anaphylaxis to contrast, we are not going to use. And also for the emergency situations like brain trauma, we are going to use the non-contrast type. And also patient is suffering from the CKD or any other renal conditions, we are going to use the NCCT. Next, CECT, contrast mediator, which conditions we are going to use. Contrast mediator can be used for the vessels, different types of the vessels, aneurysms can be used, GIT conditions, and also renal conditions. Wherever we can send this, we can see the CECT indications. Contrast enhanced, we are going to see. But contrast enhanced, we need the important part. Before we proceed to the contrast, we have to make sure that patient having no conditions of the CKD or the renal. So this is the prerequisite that the patient has to fulfill. So for that, we have to take the serum creatinine labs before the procedure, before the contrast that we have to give for this patient. Okay, before the contrast that we have to give for this patient. And the contrast, the most commonly used contrast is the non-ionic type. This is a non-ionic type which is considered as the most safer type of the contrast that we have to use for these patients, right? Next, moving on to the MRI. So MRI is not going to use the X-rays, rather than it is going to use the magno radiation. So it is more of the magnetic. It is going to use of the more of the magnetic. And whenever you see, this is highly magnetic, so it can pull the all type of the metals. So that's why we are going to put this in particular room. This room is known as a Faraday cage. This room is known as a Faraday cage. So in the Faraday cage, we will be using of the different type of the metals which can prevent the exposure and which can prevent the magnetism, high magnetism from the other metals, and it can cause the severe detriment, right? So severe damage also. That is why we are going to build this MRI room in the Faraday cage. And CT scan is using the gamma rays, so more the radiation exposure. For this, we are going to use the lead painted room. So we are going to use the lead painted rooms for the CT scans. So MRI is used by the Faraday cage, and most commonly in the MRI, we are going to use the gadolinium. So gadolinium is most commonly used to contrast for the MRI conditions. So MRI conditions have the two types images. One is the T1 image, T1 weighted, and other one is the T2 weighted. So T1 weighted, so the more the black, you are going to see that as a fluid. So remember like this, World War II is more white, World War I is more black color. So in the fluid of the World War II, it is more in the white color, and World War I, which will be in the more black color of the fluid. So this is just differentiating between the fluid and the blood vessels, T1 weighted and the T2 weighted images. But we have the contraindications for the MRI. So highly, the patients absolutely contraindicated, those who are associated with the pacemakers, we are not going to send them. And also cochlea implants, we are not going to allow for these patients. And any type of the metals, whether it is a gold, silver, any these patients also we are not going to allow these patients. And also those who are suffering from the claustrophobia patients also we are not going to allow. And also patient who is having the active seizures, we are not going to send these patients, right? These conditions we are not going to send the MRI patients. And who are not contraindicated and best is for the pregnancy. So pregnancy should be avoided from the teratogenicity. So MRI will be the one of the exceptions. And also copper related, which will be allowed in these patients. Stents, coronary stents, which will be associated. And titanium orthopedics is also allowed for these patients. And oral gastro tube, and also Riles tube, Foley's catheter, which can be also sent for these patients, right? These are the not contraindications conditions that we're going to see. Next, PET scan. So PET scan is a this is highly going to have the maximum radiation exposure. Maximum radiation exposure. Okay, almost it is going to have 30 gyrus which will be exposed. So PET scan is going to important for the malignancy, highly malignancy, and also important for the metastasis. So for the PET scan, we are going to use the chemical that we are going to use for these patients. That is known as a FTG. G means it is a glucose derivative. Okay, FTG 18 glucose. FD18 glucose we are going to use. So what is the principle behind this? So tumor cells are highly intake of the glucose and they can produce the aerobic glycolysis. But tumor cells which will be dependent on the glucose and they going to produce the anaerobic glycolysis. So this theory is given by the Warrenberg. This theory is given by the Warrenberg. Warrenberg has said that more the tumor cells, they initially depends on the aerobic, but over the time from the glucose they made the anaerobic glycolysis. So when you give the glucose, so you are going to visualize where the high glucose is concentrating. So more the high glucose is concentrating, so there is a tumor underlying that. So that's why we are going to see here. But in that the brain is spared from this particular x-rays. So brain is going to take the high glucose only because it need the more the energy, more the perfusion, more the neuron function depends on the glucose only. So brain is spared, and here you can see this is more black, right? So that means here there is a high tumor because of high glucose intake by those tumor cells according to the Warrenberg hypothesis. Can we get the false interpretations? Yes, false interpretations can be get from the PET scan. Example, TB also going to take more and more glucose. We are going to get the false results from the tumors and the TB. And here you can see this is the another scan. This scan is known as a DEXA scan. So DEXA scan is used for the osteoporosis, bone mineral which we are going to see, fat how much is the present patient is going to see. All these important points which will be seen in the DEXA scan is a gold standard for the osteoporosis. If it is a minus 2.5, it is considered as a significant risk of the osteoporosis in the patients. And we use the different types of the nuclear medicine, and in the nuclear medicine there are the radioisotopes that you have to take note. For example, HIDA scan is used for the hepatic pathologies, for example bile leak, patients of the bile leak, and also cholecystitis, and also atresia, biliary atresia. We are going to use the HIDA scan. And percutinate is used for the salivary glands and also thyroid lesions and Meckel's diverticulum. And DUMSA scan is used for the kidney anatomy. This is used for the kidney anatomy we are going to use. And DTPA scan, this is used for the kidney function. So kidney function is GFR, right? We are going to estimate from the GFR from this. And SESTA-MABI scan is used for the parathyroid glands. This is used for the parathyroid lesions. MBBS scan, this is used for the pheochromocytoma. Pheochromocytoma we are going to use. Next, thallium. Thallium is used for the heart, especially for the perfusion, heart perfusion. MDP scan, this is used for the bone pathologies. And gallium is used for the sarcoidosis and also lymphocyte conditions. And 18 FTG is used for the PET scan and also metastasis. We are going to use these different types of the radioisotopes. And radioisotopes is having the different types of the half-lives. Once you give this, it is going to stay in the body. Technetium 99 we use, this is going to stay for the 6 hours in the body. Iodine 131, this is going to stay until 8 days. Gallium is 78 hours. 18 FDG is going to stay around 120 minutes in our body. Thallium is stayed almost 73 hours. So the minimum is going to be the technetium 99, and in this list the maximum is the iodine 131 is for the 8 days. And even we have the highest also. For example, cobalt is going to stay for the 5.6 years, almost years, 5.6 years. Okay, this is very highest. That is the cobalt, that is used for the, not for the diagnosis, this is used for the treatment, and these are used for the diagnosis purposes. Next, let's go by the system by system. We will be understanding different types of the lesions here. So here you can see this is the crescent shape seen in which condition, guys? Subdural hematoma. Remember, like sickle shape, subdural hematoma seen in the crescent shape of the condition. Next, this is the biconvex shape is seen in the epidural hematoma. This is seen in the epidural hematoma. Next, here you can see opacity is seen in the basal cisterns, right? This is the basal cisterns. You are going to see the opaque, and this is seen in the subarachnoid hemorrhage that you are going to see, right? More white color. Why the white color is seen here? Because there is a subarachnoid hemorrhage. The aneurysm which is ruptured is going to pull the blood into this arachnoid structures. Next, here you can see this is more the dense that you can look here. This is the hypodense, and the hypodensity is seen is in the ischemia conditions. If there is a decreased blood supply, that is going to show the ischemia. Next, here you can see there is a air that is trapped here. This is also hypodense. Air is trapped inside the soft tissue. This condition is known as a pneumocephalus. So whenever you see the air, you add the pneumo before the word, that is the pneumocephalus, which will be seen in the patients who is having the anterior cranial fossa fracture. And this sign is known as a Mount Apu sign. This is a PYQ of the ionicity. Next, this is the schwannoma. So this is the condition of the schwannoma. So how I said it is a schwannoma? For example, this is the ears. So this is the temporal bone. So it is the petrous bone, right? This is your cerebral and the pons. So at the cerebropontine junction, if there is a tumor that is arising on the petrous bone, okay, at the vestibulocochlear nerve, that is the schwannoma. Okay, that is the schwannoma conditions, right? Cerebropontomedullary junction, there is a tumor. Next, another condition that you can see here, there is a growth. Okay, there is a growth here that you can see. That growth is growing inside and inside highly, and this is known as a angiofibroma. This condition. And angiofibroma is seen in the patients. For example, this is coming from the nose. So this is a condition, juvenile nasal angiofibroma. Juvenile means it is mostly seen in the younger individuals with the recurrent epistaxis of the patients. Next, here you can see, so these are the ring enhancing lesions. Ring enhancing lesions means more prominent the ring enhancing lesions that we are going to see, seen in the patients of the toxoplasmosis. Again, this is a recent INICET MCQ, toxoplasmosic lesions. And only if you see the tuberculoma, here you are going to observe this tuberculoma as a highly ringed, only the one ring. If you see multiple rings, that is the toxoplasmosis. Only the one ring, that is the tuberculoma in the findings. Next, here you can see this is hyperdense CT scan. How I am telling the CT scan? Bone is more prominent. Okay, bone is more prominent. And Hounsfield units, that is also showing the high, that is for the blood. So this is the hemorrhagic stroke. This is the hemorrhagic stroke. Next, here you can see again this is the MRI scan. So bone is more prominent, that is the CT scan. Here the bone is less prominent. Bone is less prominent, and here you can see this is the multiple punctuate hemorrhages that you can see inside the brain. This is due to various diffuse axonal injury. Mostly all the trauma cases we are going to see this multiple punctuate hemorrhages that you are going to see. Next, this is a Dawson's finger appearances. Seen in the multiple sclerosis. This is seen in the multiple sclerosis condition. Next, this is a target sign and ring sign seen in the TB. Okay, TB meningitis, that you are going to see this condition. Okay, next, here you can see, so this is the skull, but the skull is producing more and more thicker, right? So increased bone resorption, that is going to show this kind of picture. Increased bone resorption is seen in the Paget's disease due to osteolytic activity. This is the Paget's bone disease, and this sign is known as a cotton wool skull. This is the cotton wool skull appearances. Next, another picture that you can see. So generally the scan, that is not going to, it has to show how these are the bones, right? So it has to be, bone will be looking like a more opaque, but here they are looking less opaque, and these lesions are known as a lytic lesions, and lytic lesions are seen with the more the plasma activity. That is plasma activity seen in which condition, guys? Plasma activity seen in the multiple myeloma. This picture is belongs to the multiple myeloma, lytic lesions. And here you can see bone has to be opaque, but here it is hyper opaque. It is hyper opaque. Hyper opaque is seen in the osteopetrosis patient, bone within the bone conditions. Next, another lytic lesions, another lytic condition, right? Another lytic condition, here you can see. So this is the punctuate mark that you can see, punctuate hemorrhages, or we can also call this as a salt and pepper appearances. So sorry guys, this is the lytic lesion that we are looking at, and this is the salt and pepper appearances. Okay, so this is the salt and pepper appearances. So if you see, the bone is producing more and more activity. Where the bone has to be more activated, again I said this is the plasma conditions, but there is a punctuate hemorrhages kind of condition. So this is going to seen in the patients of the high bone marrow activity, in the patients of the anemia. So patient is having the anemia conditions. What happens? bone marrow has to produce the more blood, because in the intravascular there is a less blood, right? So here you are going to see the salt and pepper appearances or the punctuate appearances. So seen in the patients of the anemia, for example, thalassemia patients and also sickle cell anemia patients. These patients will be having this salt and pepper appearances. And here there is a bone that is a punched out or the lytic lesions that you are seeing. Again, this is seen in the multiple myeloma. This is seen in the patients of the multiple myeloma. Next, moving on to the bone lesions that you can see here and the bone conditions. This is here you can see this is the opaque and here it is a lucent. So this lesion is known as a Needus lesion, and the Needus lesion is seen in the patients of the osteoid osteoma, and they are responsive to the NSAIDs. In the condition that you are going to listen that in the history, there is a response to the painkillers that is seen in the patients of the osteoid osteoma. This is a primary benign tumor. And here you can see this is the bone, and the bone has a damage and it is going to produce the X-ray sun ray appearances. So this is the sun ray or the sunburst appearances seen in the patients of the osteosarcoma. Osteosarcoma. Next, another picture that you can see. So this is the bone. There is a cartilage associated here. So cartilage is hyperproliferated. This condition is known as a osteochondroma. Next, here you can see there is a soap bubble appearances. This is the known as a soap bubble appearances seen in the patients of the giant cell tumor. This is seen in the patients of the giant cell tumor. Next, so periosteal reaction. So periosteum, which will be associated here, right? So this periosteum is going to have the different types of the layers. So periosteal reaction, or we can call this as a onion skin appearances seen in the patients of the Ewing sarcoma. This is seen in the patients of the Ewing sarcoma. Next, another condition that you can see here. So this is a fracture, right? Distal fracture that we are seeing here. Distal radial fracture, right? In the distal radial fracture, if you can observe, the patient is having this kind of appearances. On the X-ray, if you see on the alternative picture, another picture that you can see, this is also distal radius fracture. This is also distal radius fracture, right? But they have the differences that distal radius fracture on the palmar accept on the palmar side, this is the Smith fracture. On the dorsal side, if there is a fracture, that is known as a Colles fracture. That is a Colles fracture. So this is the palmar side Smith, and this is the dorsal side, it is a Colles fracture. Next condition that you can see, so there is a bone resorption. You can see there is a bone resorption. So this is the bone resorption seen in the patients of the primary parathyroid condition. Primary parathyroid condition. Primary parathyroid condition can also produce the brown tumors. So brown tumors will be more lucent, and that is going to due to hemosiderin deposits. Next, moving on to the abdomen. So here you can see this is the coffee bean appearances, right? This is the coffee bean appearances seen in the valvulus. Most common location is the sigmoid, and the least common is the cecum. Cecum is due to adhesions, okay, and the sigmoid is due to immobilization. Next, another picture that you can see, these are the double bubble sign. Double bubble sign is seen in the patients of the duodenal atresia and also annular pancreas. Annular pancreas. Next picture that you can see, so this is the claw sign. This is the claw sign, and this opacity is due to barium enema we have given for this patient. Okay, so claw sign is seen in the patient's target sign or the claw sign that is seen in the patients of the intussusception. This is seen in the patients of the intussusception. Next, another pictures that you can see. So this is the aorta, and aorta is enlarged and the blood is pooling here. So this is the aortic dissection. Aortic dissection or aortic aneurysm. Next, same here. This is also claw sign is seen in the patients of the intussusception. Here you can see this is the multiple growths that is seen in the intestine. Okay, this is known as a diverticulosis. Diverticulosis. Next picture that you can see here, and here the patient is gas bubble that is seen. Okay, normal. Everyone will be having the gas bubble. But if you can see, there is a tube here that is not passing properly. Okay, the tube is not passing here. So if there is a coiled tube, if there is a coiled tube in the esophagus, it is not passing through the stomach, but the gas bubble is present. So this is not due to the esophagus actually. So this condition is a esophageal fistula. This condition is a esophageal atresia. So this is the esophagus, right, normally. So it is going to form the stomach, normal. But here the patient is not having the properly the patient is not having. But how the patient is still having the gas bubble here? That is due to trachea. Trachea is behind, right? So this trachea is forming the, this is the trachea, but the trachea is forming the fistula. So the air is passing through this fistula. So that is why we are seeing this, the gas bubble. But we are giving the coil, right? But the coil is not passing and it is coiling inside here. There is a coiled tube. So this is due to the tracheoesophageal fistula. This condition is known as a tracheoesophageal fistula. Next picture that you can see here, and here this is the liver, and in the liver you are going to see there is a cyst, right? This cyst is seen in the echinococcus, and there is a particularly, if you can observe, there is a growth, right, separate echinococcus. This sign is known as a water lily sign. This is known as a water lily sign. And here you can see this is the stone, gallstone. How I said this is a gallstone? Under the stone, if you see the foci, like enhancement, if you are not seeing, that is due to gallstones. If it is a polyp, there is a brightness only, there is no black, that kind of lucent will be seen. So that is seen in the gallstones. Whereas polyps, you are directly going to visualize normal growth. Same, this is the normal tissue, normal growth. Same, the picture if you see, that is the polyp. And here you can see this is the bird beak appearances seen in the patients of the achalasia cardia. This is your PYQ. Next, another picture that you can see. So this is the intestines. So intestine in the thorax. Seen in which patients, guys? Intestines in the thorax. This is seen in the congenital diaphragmatic hernia patients. Bowel loops in the thoracic region. And next, here you can see this is the picture of the lead pipe appearances. Lead pipe appearances seen in the ulcerative colitis patients. Okay, so this is the procedure of the ERCP. And after the ERCP, we are looking at the cholangiogram. Cholangiogram means it is the X-ray intraoperatively that we are going to do after the opening of the abdomen. That is a cholangiogram, especially seen for the gallbladder pathologies, gallbladder conditions, or any other biliary conditions that we are going to see this procedure. Next, so again this is the liver, but the growth is coming from here, and the condition that is pseudo pancreatic pancreatic cyst, pseudopancreatic cyst, acute pancreatitis complication. Next, moving on to the renal picture. So here you can see renal when we give the patient contrast. If you can see drooping lily sign, there is a drooping lily sign. This is the drooping lily sign, and the drooping lily sign is seen in the patients of the duplicating collecting ducts. This is seen in the patients of the duplicating collecting ducts or the duplicating ureters. Next, here you can see this is the renal, and in the renal the calyx is more prominent. So this is known as a staghorn calycus, staghorn calycli, seen in the patients of the Proteus infection, recurrent UTI due to Proteus. This is known as a staghorn calycus. Next, here you can see complete kidney itself is having the autonephrectomy. It is having the autonephrectomy, seen in the patients of the putty kidney. Putty kidney. Next picture. This is the kidney that is fused, and this is seen known as a horseshoe kidney. This is the horseshoe kidney. Next, more prominent of the ureters in the distal end. This is known as a ureterocele. Ureterocele. This sign is known as a cobra head appearances. Cobra head appearances. Next, another two conditions of the renal here that you can see, and here you can see this is the kidney. Kidney has to show more opacity because it is a soft tissue, but it is showing the air, right? Air in the tissue, that is the emphysema, emphysematous pyelonephritis. Emphysematous pyelonephritis is seen in the patients of the diabetes mellitus, more severe condition of the UTI, and this is seen in the patients of the unilateral vesiculo ureter reflex, unilateral vesiculo-ureter reflex, because there is a recurrent UTI which is causing this kind of coarse condition that we are going to see in this patients. Okay, and that is a unilateral, and here you can see this is the bilateral. Two sides, there is a ureter, calyx, the structure of the collecting system is disturbed. This is seen in the vesiculo-ureter reflex patients. Okay, so the condition that is most commonly seen with the UTI, recurrent UTI patients, and this is known as a retrograde flow. That retrograde flow is damaging the kidneys. Next, this is the bladder condition, and bladder is proliferating more, is seen with the neurogenic bladder. This is seen in the patients of the neurogenic bladder. Next picture. This is the urinary bladder. The posterior urethral wall, more prominent posterior urethral wall, because it is a dilated, it is not going to go further. This is dilated. The defect is posterior urethral wall absence. Okay, next moving on to the chest radiology. In the chest radiology, if there is a more prominence of the air around the heart and around the structures, that is seen with the pneumomediastinum. Only it has to be in the lungs, but if it is filling the gaps, the spaces between the lungs, that is known as a pneumomediastinum. And here you can see there is a blurring of the costophrenic angle. The costophrenic angle is blurred here, is blurred, seen with the patients of the effusion, pleural effusion, if there is a fluid is present here. Next, more prominent of the growth, more prominent of the growth which look like a popcorn. So popcorn calcification seen with the patients of the pulmonary hamartoma. It's the most common benign tumor. Next, you can see this is the pulmonary artery, aorta, vena cava, and there is an emboli. So this is the pulmonary embolism. Next, another picture, same. Here you can see there is a hydrothorax. and at the same time there is a air is trapped. So this is known as a pneumohydrothorax, and this is more of the pneumothorax because here you can see this is a bronchial thickenings, but there is no bronchial thickenings, and the lung is shrinked and the trachea is deviated. So this is known as a pneumothorax. Next picture that you can see here. So this is a tram track appearances, signet ring appearances. This is the tram track plus signet ring appearances seen in the patients of the bronchiectasis bronchiectasis patient. And here completely the lung is collapsed, the trachea is deviated, atelectasis. This is known as a lung collapse or the atelectasis. And here you can see the patient is having the picture, the paradoxical breathing, the rib cage is pulling inside, so the lung space is decreased. This is seen in the patients of the failed chest, multiple rib fractures, multiple rib fractures. All right, next moving on to the another picture that you can see here. This is the lateral decubitus position. This is the lateral decubitus position, and under that there is a lung. Here you can see this is whole the lung, but here the lung is filled with the fluid plus air. So this is known as a effusion, more prominent, best we can visualize from the lateral decubitus position. And this is a CT scan thorax. In the CT scan thorax, if you can see, there is a more prominence of the vascularity, and also bronchia is going to see the more air. This is known as a air bronchogram sign. Air bronchogram sign. This is seen in the pneumonia patients. Air bronchogram sign. And here you can see this is the opacities, right? These opacities are known as a ground glass opacities, seen in the patients of the COVID-19. Next condition that you can see, this is the hollow sign. It is also seen in the patients of the COVID-19. Next, coming to the ultrasound of the thorax. In the ultrasound of the thorax, if you see the seashore sign, this is the seashore sign. Okay, this is normal. We are going to have, there is a seashore sign. But if you see there is a barcode sign, this barcode sign is seen in the patients of the pneumothorax in the ultrasound vision. Next, another CT scan. So there is a air bronchogram sign, right? This is the air bronchogram sign. Along with that, there is a consolidation seen in the patients of the acute respiratory distress syndrome. Next, moving on to the cardiology. So this is like a money bag sign. So heart is dilated much bigger, seen in the patients of the pericardial effusion. And here you can see there are the many types of the curly bean sign, but the cardiac thorax is increased. Same at this sign, there is a effusion in the pleural region. This is seen in the patients of the congestive heart failure, primary congestive heart failure. Next, so here you can see this is a boot shape seen in the tetralogy of Fallot condition. Next, here you can see this is the egg on string appearances. Egg on string appearances seen in the transposition of great arteries. Here you can see eight position. This is known as a eight position or the snowman appearances seen in the total anomalous of the pulmonary veins that you are going to see. And this is the box shaped heart, complete dilatation. Box shape or the complete dilatation is seen with the Epstein's anomaly, and Epstein's anomaly is seen with the lithium exposure in the maternal. Next, here you can see this is the 3 sign. This 3 sign is seen with the coarctation of aorta. This is seen with the coarctation of aorta. Next, coming back to the mammography. So there is a popcorn calcification. Popcorn calcification is seen in the patients of the benign tumor, fibroadenoma. Patients with the fibroadenoma. Next, here you can see this is the yolk sac. Yolk sac is seen in the early pregnancy sign. This is the early pregnancy sign. Next, double decidual sign. This is known as a double decidual sign. So where you are going to see yolk sac plus the gestational sac. This is the double bubble sign or the double yolk sac sign that you are going to see. And this is the embryo is properly formed with heart activity. So with cardiac activity, so embryo with the cardiac activity that you are going to see. Next, this is the lemon sign. So lemon sign is seen with the anencephaly, whereas there is a banana sign. Banana sign is seen in the bifida, spina bifida condition that you are going to see. Okay. Next, bagel sign is seen with the ectopic pregnancy. Snowstorm appearances. Snowstorm appearances under the transvaginal ultrasound that is seen with the patients of the molar pregnancy. Okay, molar pregnancy. These are the conditions of the gynecology. Next, we have the Bired's classification and the Thyroid's classification that is highly important. For example, here you can see the thyroid classification. 0 means there is no need of the additional imaging. We have to recall for the additional or expected await for the prior examinations. 1 is for the negative, it is a benign condition, routine screening only. 2 is also benign condition, routine screening. 3 is probably benign, but it is a short interval, as at least less than 6 months we have to look after. 4 is for the suspicious, 4 is for the low suspicion, 4B moderate, 4C is the high suspicion, at least more than 50%. 5 and 6 is already confirmed. We have to go for the tissue biopsies and the clinical approach for these patients. Okay. Next, another pictures that you have to remember is about the ENT signs. Okay. In the ENT, especially we have the different names for these views. For example, Caldwell view. So Caldwell view is about the sinuses. It is going to visualize the frontal sinus properly. It is going to visualize the frontal sinus more prominent. Next, water view. Water view is for the maxillary sinus. And the Peary view. The name Peary view. Peary view is for the, this is for the open mouth. Okay, water view is for the closed mouth. Peary view is for the open mouth. And open mouth we are going to look after for the sphenoid also, and also at the time maxillary also. Townis view. Townis view. This is for the petrous bone. Okay, petrous bone we can look after here, and also mastoid. Mastoid air cells also visualized here. This is for the petroid bone. So these are the important points about the radiology and the important PYQ signs that we have discussed here. So please do revise this, and also do watch all the other 19 subjects which we have already discussed in the less than 10 days. You can revise all these topics like 1 to 2 hours and then spend on the MCQs revision. Okay, take note of these important points which can be expected, at least 50 plus topics, and then upcoming session on the Sureshot topics also you can have them, and from them also we can expect at least 50 topics. So 50 plus 50, at least 100 concepts that can be seen from this only. Okay, concepts which will be definitely reflected in the examination. So please don't give mischance for this. Please utilize this opportunity so that you can maximize your score. So don't forget to subscribe and share with your friends, and please avail this file in the below Google Drive link.